So we kept on discussing during the lecture that there are some peculiar differences between the male and a female hip bone. The question arises, how would you know whether a particular bone is male or a female hip bone? So let's see the distinguishing features one by one. First of all, if you observe the greater sciatic notch, it is wider in females, making almost an angle of 75 degrees as compared to the males, where it is 50 degrees. Then we have the curvature of the iliac crest that are more pronounced in the males as compared to the females. The iliac fossa is deeper in males if we compare it with the female iliac fossa, but the pubic crest is shorter in males as compared to the females. Now coming to the ischiopubic rami, they are everted, that is, facing away from the median plane. This eversion is to facilitate the attachment of the crus of penis in males. The preauricular sulcus is more marked in females as compared to the males. The pelvic surface is crossed in males by the ductus deferens, as we've already discussed, and in females, this pelvic surface is crossed by the round ligament of the uterus. The obturator foramen is large and oval in males and triangular shaped and smaller in size in females. The subpubic angle is somewhat like this, making an angle of 90 degrees in females, and in males it is like this, almost making an angle of 50 to 80 degrees. The acetabulum is usually larger in males because the head of the femur gets attached here and is a bit larger in males as compared to the females. The pelvic surface is crossed in males by the ductus deferens, as we've already discussed, and in females by the round ligament of the uterus. So these were all the differences between a male and a female hip bone, and this is going to help you out in the identification, specifically the sex identification of a hip bone.